POTS and dysautonomia. So what's POTS? It's not a cooking utensil, that's for sure. So it's postural orthostatic tension syndrome, okay? So when you change position, if your blood pressure fluctuates too much, then what will happen is that you'll black out, or you can have falls, or you can get dizzy. All right, so having your blood pressure fluctuate without proper control is not a really good thing, especially when you're moving or you're on steps or you're driving and so forth. So POTS is a abnormal control of your peripheral circulation, your heart rate, your breathing, to create a dynamic blood pressure that suits you in your environment and in moving, okay? So if you stand up from a sitting position and you get dizzy because your blood pressure drops, that's not a good thing. So if you look at POTS or dysautonomia, what we're looking at is we're looking at an abnormal master control of our autonomic system or our automatic systems, because our body has these automatic systems that we don't think about. We don't stand up and say blood pressure go up. We don't sit down and say blood pressure go down. What we say is that our body position and our posture is telling our brain where we are in space and how we're moving. The heart rate and the peripheral circulation should just go where it needs to go. And if that's not happening, then we know that those control systems are not being effective enough. Years ago, when I first started to study neurology and I got my postdoc in neurology, we used to do online chats at night on Tuesdays for hours. And the question one night was, what causes a heart attack? And it was one of the most profound chats I ever had on the internet. And it was like ischemic heart disease, right? So ischemic heart disease, that means the blood vessel is clogged, the oxygen to the heart goes away, and then you have a heart attack. Well, you know, 60% of heart attacks are ventricular fibrillations that have nothing to do with arterial stenosis, where the arteries are blocked and it blocks blood flow. It's actually you are so stressed out and your body's ability to stop the heart rate is not there anymore, that it doesn't dampen. It doesn't dampen the heart rate, and the ventricular valves start to fire so rapidly it doesn't pump blood. And then a person will pass away. And they had these defibrillators that turn it back on. Well, ventricular fibrillation is not a heart event, it's a neurological event. That means that you've been stressed out all your life, that you're stressed to death. So what we need to do is we need to balance the autonomic nervous system. And when an autonomic nervous system is not balanced, it's called dysautonomia, okay? So a person with POTS has dysautonomia. A person with POTS may have digestive dysregulation, may have respiratory dysregulation, may have dysregulation of their urinary system, their kidneys, and so forth. So the controls from the brain for all our organ systems are so important. And they are integrated with all our movement systems, all our visual systems, all our auditory systems. And with the subcortex, we have our limbic system, which is our system for our emotional controls, for our short-term memory, and so forth. So the brain is such a comprehensive, integrated system that if you're going to address POTS, you just can't hydrate yourself to death. You have to look at those controls, and you have to find out which ones are weak, which ones are strong, and they need to be balanced. So when you come to the Back and Neck Pain Relief Center and you see us, we want to balance all your systems so that your autonomic controls are perfect and that they work the best. I had a case, amnesic from a brain trauma, 2 hours of memory a day. When we'd spin him in a chair, his heart rate would fluctuate from 120 down to 60. It was banging up and down, and making this guy dizzy and off base and so forth. So he had dysautonomia of his heart rate. It didn't control right, so that it was like at 70 or 74 to 72. It was just too wide of a control level. So as we got him better, his heart rate became under control, and a lot of his anxiety started to decrease when that happened. And a lot of his memory started to come back, so that he remembered for a full day rather than 2 hours, and then had memory into the next day, and then into the second day. So he's doing really well. It's been about 2 years. But when you work on these controls and get them to operate properly, then dysautonomia and POTS is a thing of the past. Thank you.